Tees Esk and Wear Valley's NHS Foundation Trust provides mental health services for 1.6 million people in County Durham, Tees Valley and parts of North Yorkshire. It also provides a range of learning disability and addictive behaviour services in the area, as well as specialist mental health and learning disability services to other parts of Northern England. Services are provided from 9 inpatient hospitals and outpatient and community services across the Trust.
Hello, my name is Lewis Bell. I'm a physiotherapist and senior back care advisor working for Tees Esk and Wear Valley's Foundation Trust. This is my invention, which is the AbleHand Assistive Hand Splint, and this has been made in conjunction with Teesside University, NHS Innovations North and with Medical Devices Technologies International. I invented the AbleHand due to a previous patient of mine who had limited fine motor control and movement within their hand. It was designed to improve the position of the hand and to increase their independence. Before the AbleHand, there was nothing on the market that would meet my patient's clinical needs.
The AbleHand can be used as an aid for upper limb rehabilitation and/or with activities of daily living. It allows various implements and tools to be fitted at both ends on the splint, while maintaining the hand in a functional position. Implements and tools can be fitted at varying angles and depths to suit the required function. Anthropometrically designed to fit the hand, it may be for multi-patient use following infection prevention and control measures. It is made from durable microcellular polyurethane and is non-toxic, non-porous and waterproof.
Can tools be used at both ends of the AbleHand?
Yes, the AbleHand is designed to have implements put in at both sides at different angles, and you can also change the depth of tools that you put in there. So for example, a fork could be put in at any sort of angle there and could go deeper if somebody has reduced movement, or you could also take the fork out and change the angle, which will then be complemented by the range of motion that the patient has. Implements can be put in both sides, so for example, you don't have to have a spoon in the front of the hand splint. You can actually put that into the back end so that people could even stir some food products, for example.
So how would the use of the AbleHand benefit such as a stroke patient?
Sometimes with stroke patients, what happens is they lose an awful lot of their gross motor skills. So these are the big movements within their upper limbs. So by placing the hand splint in position, and for example, you could put in a pencil, and then you could look at getting the patient to also focus on eye-hand coordination by increasing movements along, for example, a line. So you could put a line on a piece of paper and get the patient to follow that. Therefore, what it's doing is increasing the gross motor skills and range of motion within their upper limb.
Apart from stroke patients, what are the other conditions we can use AbleHand splint for rehab purpose?
Well, depending on what you're going to try and rehab the patient with, you could, for example, have a predetermined pattern as I have on this paper, and therefore you could ask the patient to actually follow those lines. Thereby, once again, you're using hand-eye coordination, but you're also then predetermining which range of motions that you are after from a rehabilitation point of view. The hand splint is designed to maintain the hand in a functional position. It is designed so that the forefinger and thumb fit closely around the neck section and the hand fits around the body of the hand splint. The hand splint must not be used the wrong way around, as this will place the hand in an incorrect functional position. Once positioned in the hand splint should not be moved, as this may cause adverse skin tension. It is important that the correct size splint is used for each individual. It is recommended that the AbleHand is only used for shorter periods of time in the initial rehabilitation or treatment. If required, the treatment duration can be gradually increased. Always check the condition of the skin following use of the AbleHand, just to make sure there are no areas of redness or any pressure points. The AbleHand can be cleaned using warm soapy water or mild chlorinated water if you need to follow infection prevention and control guidelines, or simply use a wet wipe to clean the hand splint, and then after use make sure it is completely dry before you use it again.
This simple yet practical innovation, invented by NHS practitioner Lewis Bell, is unique in its ability to allow clinical autonomy for uses for rehabilitation, to promote rehabilitation and/or functional daily activity independence, not restrict use with one type of implement or tool, to allow implements and tools to be fitted at both ends and at different depths to increase the possible uses, and may improve patient hand-eye coordination. The AbleHand is yet another example of how inventive people are in the NHS in their desire to improve healthcare. These sort of good ideas can only happen if NHS people have the confidence to voice their good ideas. Those good ideas receive active, enthusiastic professional support provided by NHS innovation teams. The NHS collaborates with capable commercial partners such as MDTI, and this is what we can achieve when we work together.